For cosmetic purposes, I've always wanted to have my bunion removed. However, it was not causing me any pain, so I decided why have surgery if it wasn't necessary. In the last year, I have been experiencing pain that has waken me up at night, that hurts when I put on shoes, and was interfering with my daily activities. So I decided to have it removed. Re-op was COVID test, blood work, no food after midnight. I could drink water in clear liquid. So I'm at home in bed after my procedure. I arrived at the surgical center at 11:20 and I left about 5 p.m. and I am doing okay. I've had dinner and I am elevating my foot with ice, and I've taken some pain medication, and we'll see how I am tomorrow. I have ice at the top of my ankle and underneath my knee, which I was told is the best way to prevent swelling. Hey, it's day after the surgery, so it's post-surgery, day 1, and I'm doing well. I was instructed to take the medication every 4 hours prior to pain kicking in, so I have not had any pain whatsoever. I still have the ice bags on, one across the top ankle and the other one underneath the knee. And I am staying off of my feet. I did get up this morning and I have crutches, and I was able to maneuver around the kitchen for a little bit. For the most part, my sister, who is my caretaker, and she's been quite fabulous, has been doing everything for me. And I have a couple more days of staying in bed and off my feet. And then I'll put on my pretty black, shoe, and I should be able to put a little bit of weight or put weight on it. She said for me to walk on my heel around the house, unless it hurts, in which case don't do it. So I'm hoping it won't hurt and I'll get to at least walk around. So that's it, day after surgery. So I'll keep you posted on how it's going. Here's the pretty black shoe I was telling you about. So I'm still not applying pressure right now. I'm just standing on my other foot showing you the shoe. I am walking with my special shoe and able to get around the house on my own and do what I need to do. And I am off the Norco, Motrin only, 3 times a day. I'm in, I don't know what to call it. It's not really pain, maybe it's not even discomfort. I know I had surgery on my foot. The pain is less than the actual bunion itself. So I'm very happy that I went through with the surgery, because I was a little leery and skeptical, especially watching the videos, because people had a really, really rough time. They were saying they couldn't drive and how they had to, they would wake up in the middle of the night in a lot of pain. And so I was kind of nervous about it, but that's not been my experience. I think the doctor, of course, she did a fantastic job, and I've been doing my part. I have to say, I am staying off my feet. I'm taking it very seriously because I don't want any setbacks at all. I can't afford that. And so I am elevating as told. I am icing, and I only walk around no more than maybe 15 or 20 minutes at a time, and then I am back in my position. So maybe that's part of what's happening. But I also think it may have been a simpler procedure than some of the ones videos I watched. So I'm hoping this video will be helpful to those who are thinking about doing it but have some fear, because it really depends, I think, on the individual, of course, the surgeon, and the procedure. So I am very happy that I had it. It's going really, really well. So I'll let you guys know how it's going later. I have post-op surgery in a week where they'll unwrap it, rewrap it, and I'll still continue to be in the shoe for up to 6 weeks. So I still have some more time to go, but the most important part is that it's not excruciatingly painful, and that was one of my concerns. So I shower, and a lot of people wrap their foot up in plastic in order to take a shower because you're not supposed to get the bandage wet at all. And I decided that I can take a bath. However, I am taking a bath when my daughter is home just in case I get stuck in the bathtub because I'm not exactly sure how I'm going to get out yet, but I'm enjoying it while I can. I just wanted to update you and let you know that I am experiencing some burning and tightness in the area of the surgery. I just had to take a couple of Tylenol. I had not taken any medication at all today, and it's about 1:30 in the morning, so hopefully the Tylenol will kick in. Good morning. It's day 13 of my post-surgery day. I'm walking around on the special shoe. I am able to apply pressure, and as long as I take my time, I have my post-surgery appointment today, and I'm looking.
Do you have any other post-op schedules yet?
I do.
You do? Okay, good.
Yeah, x-ray and a...
Next time, right?
Yes.
Okay. Are you having pain right now?
No.
Good.
No, not right now. This is the most I've been on it, though, since the surgery.
Good. I can tell, too.
Can you?
Yeah, because you're dressing. See how clean it is?
Yes.
Yeah.
And that happened, I think, the first time.
I've been following direction. I'm like, we can tell.
Really? Okay. See, that's good to know. Because honestly, the first time I actually did too much, I saw that it blew through.
Yeah.
And after that, I was like, nope.
Yeah. It'll bleed, and then it'll be obviously more painful because there's more swelling.
Wow, it's weird
really
to
nice.
see without the bone bulging out. And my toe looks straight.
Yeah, it does. It looks really good.
Thank you. Man, they did it crazy. The cut's not as big. I couldn't even imagine what it looked like because I watched a lot of videos.
Yeah.
And they just had some scars that were so bad, and their feet look so swollen.
They're probably older videos.
No, some of them within the last 9 months or so.
Yeah, and then of course, they all have different ways of. Not everybody qualifies for the there's different procedures.
That's what I learned.
Mm-hmm.
Yeah, I think mine was probably the less aggressive type compared to what I've seen. Yeah, that looks great.
Alrighty.
Just because I want the suture holes to be good.
Okay. So I'll be, however you're going to wrap it, I'll see it as something I can, maybe in a couple of days, be able to unwrap and wrap back up. Or is it something like...
Essentially, you kind of leave the tape that I would put on it like this fall off on its own. I'm taking it off because I'm considering removing stitches, but...
I'm going to take a look at it first.
Yeah.
It's so funny to see it. My foot, it looks like I can say it's still a little swollen, but
Yes.
I was telling her that it's not nearly as bad as I had expected it to be because I'd watched a lot of videos and I was like, oh my God.
Yeah. Okay. All right, give me a second. I'm gonna go talk to one of the surgeons who's in on the case.
Okay.
Trying to figure out. I wasn't on the case, so I kind of had to figure it out.
Yeah.
It looks like they left a tail, but it looks like an absorbable suture. So
I think from what I can recall, she told me it was going to be absorbable because she did mention something like a tail.
Yeah.
That you have to pull out later.
Yeah.
And that sometimes you can feel the pull, but
Yeah, I'm looking for kind of a knot, but let me see if I can find the surgeon
Okay.
who's actually been on it.
Okay, thank you.
Still swollen, but the bump is gone. And it feels really weird. I've had that bunion at least for 30 years. So I think I'm gonna like it. Once the swelling goes away and I get my fresh pedicure.
Okay, you can let these fall off on their own. If you do get them wet, try to just dry it, okay? You don't want to let soak in water yet. If you get the foot wet, just dry it right after, okay?
Okay, so my surgeon was at a conference, so this doctor was filling in for her. I was surprised that he did not rewrap the foot and that he only applied the strips to cover the stitches, which are dissolvable. I can get them wet, but I am not to immerse the foot into water. You can see on the x-rays, the one on the right is the before and the one on the left is the after picture. You can see there is a pin that was applied to hold the bone in place. I'm never to apply pressure on the foot without wearing my shoe, which was emphasized. I was given a new shoe and asked for an extra one so that I could have one for the outside and one for inside. Thank you, Gloria BTV, for recommending that in your bunion post-op video. I can bend my toes back and forth a few times a day. My foot is swollen and bruised, so I am to continue to ice and elevate. I did experience some shooting pain and throbbing for the next 2 days after the visit, especially at night. The pain was about a 7 out of 10, with 10 being the highest, and the pain now is a steady 2. I'm taking Motrin 2 times a day. My next appointment is in 4 weeks. They will x-ray the foot and give me additional foot exercises. And that concludes part 1. I will give you a follow-up after my next visit. I did this video of my experience, hoping that it would be helpful to someone. Good luck on your surgery. Get a lot of rest, stay hydrated, eat healthy, and heal well.